Uh, Sir, may I ask you the next question? You've really been a leader, leading an institute in Hyderabad, but now leading AIIMS Delhi. In your experience, and you've also gone through the journey of a medical student, clinician, and now a health system leader, in your own lived experience, what are some of the key triggers for burnout and stress that we see within the medical fraternity?
Thank you, ma'am. First of all, namaskar to all of you. Well, when I look into the topic today, I have three things to do here. One, spirit of medicine. What is the spirit of medicine? For me, the medicine is, there are people from the community medicine here and the health leaders, the world health leaders, physical health, mental health, social health, and spiritual health. That's where the people like our teachers like our are bringing the spiritual health to the medical students and doctors in the institutions. So that's the component of the spiritual, the spirit of the health. What is the joy of work? Sir talked about the inner peace, inner joy, and we have been speaking about that, consider the patient as a god, and then service as a god or something like that. So we have that, the patient is my god and it is the best of the treatment which I have to give. Then there is that joy, inner joy, that's definitely there. But definitely there is a challenges for us in the institutions, in any institution. It's not just the medical college. In most of the hospitals, we have deficiencies, whether it is human resources deficiency, equipment deficiency, workload is very high, burnout is definitely there. What can we do? We can't look into the country and say that, we have less number of doctors, nurses, technicians, and we stop doing our work and say that, my job is over. I will not do more than 8 hours of the duty in a stretch, and I will not do 24 hours more than that. Then it is not going to happen. That means before we think of how we can change the ecosystem, is there anything which we can have the resilience within ourselves? The joy of work again. If we think that way, then instead of abandoning our duty, not looking into the work life balance and all that, you have to balance with the life. There is only life. It is our life and the patient's life. So it's the work is always there. The balance is always 100%. We are doing only work because the work is giving the life to the patient. So that's the work-life balance for us. And then those who are from the Karnataka, if you go to the assembly there, it's written Kai Kare Kailas. So this great Sir Vishweshwaraya's saying, which mean to say that, the work is worship, If we take that work as a worship, saving the patient, have the joy inside to give that help, then I think we will be balancing initially until and unless we get into that kind of increase in numbers of all our ecosystem which is there. The other thing is that, being a doctors, definitely we are always exposed to the more work. We need to distinguish between what is that. The stress is, I think, physiology professor is there. We have been our students and she is our physiology teachers at AIIMS. We need to distinguish between what is eustress and distress. If I work, say, more than 72 hours, if I save some children, if I am able to save some lives, it's a eustress. I'm happy that, I go home or I go to the hostel and I come back to the teachers, parents and say that, well, I did such a wonderful surgery or I saved someone. Or you don't feel that you have worked 24 per 72 hours. So somewhere we need to distinguish and then bring that stress into the eustress, put it to the positivity, and then say that, we have been happy. Because you can't, go into the ecosystem. It's not going to change in one day. We need to be, adapting to the things, whatever is there and feel happy about it and then do that, get the motivation from the great people. There are people who are motivation for all of us here, every one of us, which are different streams or something. Burnout is definitely a problem. In the institutions, we have ecosystems. For example, for our undergraduate system, the students, we have a wellness clinic. Unheard of, the wellness clinics in medical institutions for decades. Madam is part and parcel of that. It has everybody. It has the medical teachers, the first MBBS teachers. It has the senior students. It has a psychologist. It has a psychiatrist. And then it is 24/7 at the hostel. And then anonymity is maintained, and then they are taken care of everything, whether it is the social support, the mental support, spiritual support, or the psychiatrist and psychologist who is going to keep that. But that's the component which we are giving it to the students. The other thing is that how do you make them cheerful, especially the students. Now we're talking one by one, we're talking about student trust. We have various festivals which are happening. Unfortunately, the market forces and the feeling in the students today is that, if we do one big event costing 2 to 20 crores of so-called an annual event and do all wrong things and feel great about it. Now we have cut down into that into small, weekly, monthly, small activities. It could be any domain. It could be art, science, sports, music, dance, whatever it is. Every weekend, when I'm going from the office, I see somebody, going to the auditorium these days. So that is a cheerfulness. Cheerfulness and happiness cannot be in 1 week of a 1 whole year for a student. Give that small bits of pieces of the cheerfulness and the joy to the students. Maybe in a day, maybe a weekend or something like that. Thus, we are taking care of these students in the AIIMS New Delhi. Then comes the staff members. What is that staff members? What is their rights. Somebody doesn't get promoted well on time, somebody doesn't get salary on time, somebody doesn't get their increments on time, somebody is discriminated because of something, caste, creed, religion, and all that. Somebody feels that, the system is not transparent. So we are giving that good governance and transparency and the rights to the people, the staff members, so that they feel proud that now I'm happy. Let us be happy to work more, and then give the rest to the patient. So if unless and until I am happy as a medical professional, I have been making patient happy. My stress and strain will go on to the patient. Efficiency will come down, competency will come down. I will be totally, rude to the patient. And most important thing, madam will agree that, Jadu ka Jappi said, that what you need is not the medical knowledge or skills. It is the compassion. So unless I'm happy, I will not be able to give that compassion. And look into the faculty levels again. The faculty levels again, what is that the thrill we get as an institution. We talk about the finances. We can't change. As we can't change the ecosystem in the country with numbers, doctors, sisters, we can't produce them in one day. Our patients are not going to come down. The diseases are increasing, in fact, paradoxically. So what is that for these faculty members we can give? The professional satisfaction. Financial satisfaction is not going to be there. The bureaucrats are not going to give us the more salary. So only thing is we have to be happy with our own self. Give us that ecosystem of professional satisfaction. You are being accommodated within the institution. We can walk in to the hospital, post-op patient, middle of the night without the hassles of the traffic and coming out from there, here and here. Coming back to meet the people this time. Conduct the professional conferences and then meet with the people in and within the country, outside the country. Call the people from the great institutions and have an exchange with them. What is that we are doing and what is that you are doing. Go there and then see what is happening. Bring those people here and then say this thing. And then get a small, sometimes the Harvard says, oh, AIMS, you are also doing very well. Thank you.
Thank you so much. A big round of applause, Sasha. Wait, Howard, so many dimensions there. I hope I'm able to remember all of them. But I heard you starting with meaning, purpose, and connect. And having leaders like you reminding the healthcare workers how their work actually is contributing to something bigger than themselves when they're taking care of their patients.